Yes, so we are currently participating in a clinical trial sponsored by a pharmaceutical company, looking at the reasons for and the barriers to consistent care. And so for patients that have difficulty maintaining compliance, I think it's really important to understand the socioeconomic factors outside of the medical factors that play a role in patients being unable to maintain consistent and needed treatments to maintain the health and function of their eyes. And so this trial is really unique because most of the studies that we perform for pharmaceutical companies, I should say with pharmaceutical companies, it relate to a simple biologic problem. There is a disease and we must treat it with this drug. In this situation, we're really trying to take a global view of the patient, a comprehensive view of the patient, and try to understand what are their goals, what are their motivations, what do they want out of treatment? Because for me as a physician, I want their vision to be as good as it can be, and I want their retinal scans to look perfect. And then number three, I want them to be happy. You know, that would be nice too. But those are the two things I look at in clinic every single day. That's my measure of success. And I have to remind myself that, you know, not every patient that has a disease needs treatment. I think there was a really, really interesting study that I listened to Atul Gawande speak about. It was about cancer patients. And one of the survey questions was, you know, for these end-stage cancer patients was, what would you have done differently during the course of your care? And one of the patients responded, I wish I would have gone to Disneyland with my grandson. And, you know, Dr. Gwande, after asking the question, thought to himself, oh my God, if I just asked this question 3-4 months ago, we could have actually made that happen. We could have given this person at the end of their days what they wanted, what they truly felt they needed, instead of maybe more chemotherapy. And so, you know, I'm lucky. I don't deal with life and death every day, but I do deal with life-ending disability. You know, people feel that their vision, when it's taken away, takes their lives away to a large degree. And so I have patients that have lost vision that we treat that still has legal blindness. And I make sure that I ask them, and I try to do that on a regular basis, ask them what their goals are. What do they need from me outside of good retinal scans and better vision? And if we can learn more from this really controlled study, aside from my non-scientific approach, and that improves patient care, I think that's going to be an amazing thing.